Excellent. Good morning, everyone. Thanks for joining us. I'm just going to give everyone a minute or two to join in. Morning, everyone. Happy Tuesday. Good morning. We're just going to take another minute or two to let folks in. All right, just give it another. We've got 2 people who are just joining. Give them a moment to log in. Hope everyone's having a good morning. We were just talking a little bit about the trees changing colors. It's always so beautiful throughout the state of New York. So hope wherever you are in the state, you have some pretty trees near you as well. Okay. All right, I think we will go ahead and get started. Morning, everyone. Welcome. Thank you so much for joining us. Welcome to the Raising New York Early Intervention virtual roundtable. My name is Lara Kiriakou, and I'm the Associate Director of Early Childhood Policy and Advocacy at the Education Trust New York and the coordinator for the Raising New York Coalition. Before we begin, I'd like to go over just a few household or housekeeping items, if you will. So as you all probably have noticed, this is a typical Zoom meeting format. We are going to have some breakout groups later on today, but if everyone can please be mindful to keep yourself on mute if you're not talking, so we can minimize background noise. I think everyone's already doing that. I know we're all pros at this by this point, but just a reminder, and feel free to either raise your hand or put yourself, unmute yourself if you have a question. Additionally, as everyone is joining, please feel free to put your name and info in the chat box. Love to know who's here. And we are going to start in just a moment. Okay, great. Okay. We will have opportunities for discussion and answering questions later today, so please feel free to also put your questions in the chat, and we will get to those in our discussion portion. And just a reminder to let you all know that we are recording this event so that we can continue to share with stakeholders and partners who weren't able to make it today. So, all right, let's get going. I'm so excited that you're all able to join us this morning. Again, my name is Lara Kiriakou, and I am the Associate Director of Early Childhood Policy and Advocacy at the Education Trust, and coordinating the Raising New York Coalition. Raising New York is a statewide coalition of parent, early childhood, education, business, and health organizations dedicated to increasing the number of infants and toddlers who are on track for school readiness, with a focus on improving long-term income outcomes for children who are low income, children of color, and children who are in other underserved communities. And I would like to introduce a few members of our coalition who I'm very pleased and privileged to say are working with me on this event and in our work in general. Betty Baez-Mello is the Early Childhood Education Project Director at Advocates for Children in New York. Dr. Liz Isaacson is a pediatrician and the Executive Director of Docs for Tots, located in Long Island, New York. Pete Nabozny is the Director of Policy at the Children's Agenda, and Bridget Hurley is the Senior Director of Advocacy and Program, also at the Children's Agenda. Now I'm going to share some slides for a little bit, but since we are going to have a fair amount of paneling and discussions, I won't have slides up the entire time, but I will bring those up just for a little bit. Okay. So just to review.
No, why? I'm on a telehealth thing.
Just a reminder, if everyone could mute themselves so we can minimize
if there's anything exciting, she'll tell us.
Background noise. Just make sure everyone's muted, please. That would be great. So as I mentioned, Raising New York is a coalition of different partners across the state. We are supporting all efforts and policy and legislative efforts to support infants and toddlers through the first years of life. This is our agenda. We have a busy day. It's going to be 90 minutes, very exciting. We have some welcoming and introductions that we're doing right now. Going to give a brief overview of early intervention services, just to ensure that we're all on the same page. And then our first panel discussion will be with parents and early intervention providers talking about their experiences with early intervention, particularly with telehealth during the COVID pandemic. Excuse me. And then we will have our first breakout group session, which will be about 8 to 10 minutes for folks to sort of talk in a smaller group about their reactions and responses to the first panel discussion. And then we will return to the larger group. And our second policy discussion will focus on the policy aspects of the things that have been discussed, including systemic challenges, needs to support the workforce, and how our experts in that panel are working on some of those issues and how we can all continue to work together. And we'll have a second breakout group session where we can talk about some of the responses from that panel. And then we'll have an opportunity to all come back together as a larger group and share insights and thoughts from both of the breakout groups in sort of a larger discussion, which I will be tracking and taking notes for, and we'll be sharing those insights and those next steps and sort of ideas that come from this discussion in an email following this this event. And then next steps in closing. So just going to start with a brief overview of early intervention. It's a program that provides services, including screenings, evaluations, and a variety of other services for children who are under 3 who have developmental delays or disabilities, and it's no cost to the family. The early intervention includes things like speech therapy, occupational therapy, ABA or applied behavioral analysis therapy. And research is very clear that the earlier delays are identified and supported with services, the better it is for child's development. Research has shown us that most of a child's brain is developed in the first 3 years of life. For all of us, the capacity to learn is unmatched at any other time in our lives as it is in the first 3 years of life. So the more we can support families' access to early intervention services as soon as possible, the better the outcomes are for children and their families. So it is crucial that one of the things we'll be talking about today is just the urgency to get support to families as soon as possible. Unfortunately, the state across the state, there have been some long faced barriers to accessing early intervention services. Not all families are aware of early intervention services or the referral process or everything that entails. And there's oftentimes, for some families, significant delays in receiving an evaluation or receiving their services. And we know that across the state, Black and Latinx children are underserved and disproportionately are delayed in receiving evaluations and the services that they need. And these are all things that have been happening even before the pandemic and are now even further exacerbated. So just a brief overview of early intervention during the pandemic. So when the COVID-19 pandemic began in March of 22, all early intervention services shifted from in-person to telehealth format. And later in the year, last year, the early intervention program began to gradually resume some in-person options for evaluations and services. And now where we are today is it's a hybrid model. So programs are available in both in-person and telehealth format. However, many families do continue to identify telehealth as the preferred option. And so we're going to talk a little bit about that today, and you'll hear from our parents and providers, especially about some of the ways in which telehealth has been a help and supported them, and ways in which it's also been a challenge. And that's, as we can say, it's presented a new set of challenges, especially for providers who have been trained to provide services in person, doing that through a phone or a computer, especially with an infant or a toddler who might not even be interested or not even looking at the screen. It can present some tremendous difficulties, and also be a challenge when families don't necessarily have consistent access to both the internet and devices needed. And so we'll talk a little bit about that, as well as some administrative barriers in terms of paperwork, enrollment, proof of residency, all those types of things. Okay, and now I'm very excited to introduce our first panel of speakers. And we have Ribonette Carretas, who is an early intervention physical therapist from the New York Center for Infants and Toddlers Incorporated. We have Cheryl Gerber, who is the Director of Strategic Clinical Initiatives at the New York Center for Infants and Toddlers Incorporated. Brittany Jensick, who is a parent and president of Parents Helping Parents Coalition of Monroe County. Kim Dewar, who's also a parent and co-chair of the Monroe County Local Early Intervention Coordinating Council. And I'm hoping that Roxana has been able to join us. I'm going to stop sharing my screen. Very excited to have you all here. Roxana Diaz de Gutierrez is a parent who lives in Long Island. And welcome everyone. You're welcome to unmute yourselves.
Thanks for having us.
Good morning.
Morning. So glad you're all here. Thank you so much for joining us. All right. I want to ensure that our translation services are up and running. Excellent. So before we begin this panel, I just want to go through another additional housekeeping item. If you'll all look at the bottom of your screen next to all of your functions for sharing screen, chatting, there is now an interpretation globe device. And I need to ask everyone to please select a language, either English or Spanish, so that we can all continue to hear everything that's being said. If you want to listen in Spanish, our interpreter, Andrea, will be providing interpretation as we're speaking, although I'm going to remind everyone, including myself, to try to speak slowly and give Andrea a few moments to catch up as we're speaking. But if everyone can go ahead and click English or Spanish, please. Just give everyone a moment to do that.
Can you give a little extra direction for the technologically challenged person?
Absolutely, absolutely. Brittany, are you on your phone or on a screen?
I'm on an iPad.
Okay, so at the bottom of your Zoom window where we have mute, video, share screen, there should be a round ball that says interpretation. And if you click on that, you'll see two options appear, English, and under that is Spanish.
Brittany, I found it on the top more with the 3 dots, and then you scroll down to language interpretation and the globe is next to it. And you click the globe.
Okay. Thanks.
A fellow technologically challenged person to another. I glad I could
That's
help.
why
you.
we make a good team, Kim.
Yeah.
Excellent, thank you. Thank you so much. Yes, as well, I'm also a very technologically challenged folks. Thanks for helping out, everyone. Okay, great. So we will go ahead and start. And my first question is for Ribonette. And welcome so much. Thanks for joining us. If you could share a little bit about how has providing early intervention services to families changed with telehealth? What are some of the advantages and disadvantages? And what do you think would help better provide high quality evaluation and services through telehealth?
Hi, everyone. My name is Ribonette Corredas. I'm a physical therapist, early intervention for more than 20 years. And since the pandemic, I've been doing telehealth. And there are advantages and disadvantages, but I'll give you the top 3 for me as the advantage. First is parent involvement, because before, when I was doing in-home, I do the hands-on and parents have the option to follow through or do the carryover activity. But since the telehealth, there's more parent involvement, caregiver involvement. And also in my experience, like if parents are working, after I see the child after work, and then there's more parent involvement in that activity wherein they're the one who really does the hands-on and as I guide them through the telehealth session. And then the second advantage is that a child can receive services right away through telehealth. Unlike before, it would take a while before a child gets services because we in a certain area, because you have to wait for a provider that goes to the area. And as we all know, that 0 to 3 is the most important developmental stage of a child. So every month, every week, every day counts. So with telehealth, a child can start services right away while they're waiting for an in-home provider. And then also, third is I do in-home in Washington Heights area, but since telehealth start, I have provided different type of concerns of a child, which I have been doing before, like different medical condition. At the same time, I provide telehealth services in different parts of New York. I have a child in Westchester, in Long Island, in Brooklyn. So through telehealth, I could provide services that way. And also there's a lot of things that like Zoom, WhatsApp, Google's Duo, any type form of communication, internet communication that we could use. So there's a lot of options for a parent, for a family to use via telehealth. Of course, there's for me, there's only one disadvantage that I could see, which is the Wi-Fi problem, that if a parent doesn't have any device that they could use. But in my opinion to that is like early intervention or, could provide the tablet or maybe a donation. I'm just thinking, giving my recommendation. And also if, you know, it's a remote area, which I haven't experienced because I provide services in the city, like in where there's Wi-Fi, but in my opinion, like maybe in the remote places, a family could go to a certain center, and the maybe early intervention center, Department of Health center, and that has a Wi-Fi, and they could have the services there to telehealth while they're waiting for an in-home provider. It's just like our seniors have this senior recreation center where they go. So maybe some similar to that. So that's my suggestion. Thank you.
Thank you so much, Robinette. Really appreciate you sharing your experiences and insights, and really glad to hear that. Thank you. I will now ask Cheryl Gelber to also answer the same question. So I'll read it again. How has providing early intervention services to families changed with telehealth, and what are some of the advantages and disadvantages that you're seeing, and how do you think we could better provide high quality evaluations and services through telehealth?
Thank you, everybody, for being here today. I'm Cheryl Gilbert. I'm a special instructor. I also do ABA. In my role at New York Center, I'm also a director, so I help to oversee the implementation of the services, but as well as training providers in how to do telehealth. It changed a lot. It changed a lot about what we do. And I think for many of us, we were in our old habits, in our own rhythms, in our own ways of engaging with families in person. There's a dynamic to that where you build a relationship and you connect and you find ways to build trust, and you find ways to connect with children. You observe their routines and what lights children up, what makes families feel confident, what's challenging. And that was lost in telehealth. In telehealth, we were building new relationships through the computer. And that was a mind twist to figure out how to meet somebody for the first time and connect with them and build that relationship and to ramp up to a point of intervention. I found that that was one of the most challenging pieces of early intervention service, was building the relationship through this platform. On the flip side, I am surprised at how strong we were able to build relationships. And so as hard as that was, there are some families that I worked with that I never met in person, who at the end of our time together, we were tearing up, feeling like we were going to miss each other and wanting to try to find ways to keep Zooming. So, you know, it was really powerful in the beginning to experience that challenge together. How are we going to connect and do this and build this relationship? But then at the end, to actually feel like we were going to miss each other, even though we never met in person. So that was a real shift for me. I'm a relationships person. And so finding the way to build a relationship with another person over a computer or, you know, in this platform was really challenging, but rewarding as we figured it out. Another advantage, I like the way that my colleague here, Robinette, hi Robinette, described this as advantages and disadvantages. The early intervention model is a family-centered model. I love it for that purpose. I love that it's all about helping families. I like that it's all about identifying authentic routines and activities and embedded coaching and embedded interventions, and really helping to, at least, you know, the way I always approach it, empower families to find teachable moments across the entire day, to really embrace, you know, helping their child, that the therapy doesn't end just because the session's over. The session is a time to kind of check in and fine tune and tweak, and then extend it throughout your everyday life. So with the telehealth service, it was almost like there was a spotlight on that perspective of this. We really had to hone in on coaching the family exclusively. I couldn't go in and start singing and dancing and interact with the child in that way to try to create a dynamic of interaction with them. I was only really with the family in the beginning, trying to find a way to coach them, but not be there to help them. That was really hard. So coaching with that, with my hands tied behind my back, I would say that to a lot of providers. It's like being in the room with them, but your hands are tied behind your back, and you can't, obviously I speak with my hands, you can't model for them. Well, us at home, I didn't have the materials that they had, so I couldn't model with the materials that the families had. So everything that I did was through a verbal instruction. Maybe if I had a material at home, I would be able to do that. We had lots of cooking projects, lots of eggs were cracked and mixing in the kitchen, because kitchen items were a common thing that we all had. So I was trying to find ways to find the materials that I could model with. So that was a challenge, but also a good thing. I think that it really forced us as providers to think about family coaching, to think about that in a stronger way. How can we help empower families to continue the interventions outside of the sessions? How can we use the materials in the family's homes? What do we need to think about in terms of the family's actual routines and what is meaningful for them, what makes sense for them? That to me really, that spotlight on family coaching and embedded interventions was really highlighted during the telehealth services. Some disadvantage to that is that there are certainly some children who we work with that have more involved needs, and they benefit from more direct instruction from a provider who has gone through schooling and training and education and how to do this. And that was lost in this. We weren't able to provide children who have some, ABA therapy as an example. Some of these children have upwards of 20 hours a week of ABA services. Prior to the pandemic, that's 20 hours in person with a provider, where we're doing direct instruction, lots of repetition, and we're really moment to moment interacting with the child and the family. When we were in this telehealth model, that direct instruction was lost. You can't get a 2-year-old's engagement over the computer. We're not, creating opportunities for joint attention and symbolic play, all this stuff that we would do. You can't do that through the computer. So that was lost. And I found myself in a position of really thinking about it as more of a, training, and breaking down my sessions as almost like mini training modules for the family, so that, here's something that we're going to focus on first, almost like as if I was training a new provider, a new teaching assistant. Here's what we'll focus on first, and that's how the sessions unraveled. That's how the time unraveled. It wasn't about direct instruction with me and the child. It was much more about me training the parent, almost like a train the trainer model. And so that piece was certainly a big part of what I focused on for those children who had higher mandates and needed more direct instruction. With that, it required that parent with those higher mandates to be available for that extension of time. And that's really hard. It was hard in person, but it's hard when you're in the computer. And so a lot of kids lost opportunities for that therapeutic intervention because it just wasn't feasible for families to be available for that amount of time, to have 20 hours a week. There were other children in the home. They were managing remote schooling for other children. That maybe they had a partner at home who was also working from home. To Ribonette's point, the Wi-Fi situation, there might have been other family members. I had one family had 3 children, 2 with special needs, and a limited phone plan. And she said to me, I got 30 minutes to give you because I have to share this with my other children, and I have to figure out how to entertain the other children while I'm in session with you. So there's all these competing environmental factors during this time. Now, maybe that would be different if we weren't in the pandemic and it was exclusively just telehealth. But that was certainly highlighted, all those environmental barriers that created challenges. Where I think telehealth can really help us moving forward, where I see it as use, is to Ribonette's point, there are families who we can't access in certain areas, or we don't have providers available right away, and families are waiting weeks or months in order to access services. And so I do see a real benefit in telehealth minimizing travel and at least getting parents access to some sort of service, even if it's some sort of coaching through telehealth, to at least start breaking down either some of the barriers that they're experiencing, to help with some tools for some immediate needs they're encountering. You at least can get access to some level of support through telehealth initially versus waiting weeks and months for someone to come to your home. So I do see a great advantage to telehealth in that way. I think families need to have access to Wi-Fi. Families need to have access to a computer or a tablet or the device, the technology in order to do it, and in an equitable way. That was a big barrier. And then I'll wrap it up here. How can we do better with evaluations? It's the same kind of thing. You have to train families. There's maybe a training component on how to do telehealth, what to expect, how to engage in the platform. Training. I think we need training for families and we need training for providers. We all were just thrown into the water and figured it out, which is great that we found some ways. But I think moving forward, we need to do training for parents. We need to do training for providers, what to expect, how to get the most out of telehealth, and what it can do for you, I think would be helpful in providing both quality evaluations and services.
Wonderful. Thank you so much, Cheryl. There's so much there that I'm sure many of us will look forward to discussing in our breakout discussions. Thank you so much for sharing your experiences and insights. And now I'm very excited to introduce a few parents who will also discuss their own experiences. And I'd like to start with Roxana, if everything's good. Hi. Good. Yes. Yes. Thank you for clarifying. Yes, everyone. Yes, whatever language you're in right now, if you're in English, you'll see an EN at the bottom of your Zoom window. If you would like to switch to the Spanish channel, you just click on that and you'll see the Spanish at the bottom pop up. And so basically we just have two different audio channels. And so Roxana will share her comments and insights with us, and then Andrea will provide the English interpretation for some of us who need it. Great, thank you. All right, good morning, Roxana. So thank you so much for joining us this morning. How are you experiencing telehealth services with early intervention? How have early intervention services worked well for you and your family? And what challenges have you and your family encountered? And what would make the telehealth experience better for you and your child and family? Thank you all for your patience while we navigate. I think we might be having a few challenges with the technology. So we will definitely come back. I would like to, oh yeah. Oh, great. Perfect, thank you. I wonder if she's in the other channel. Okay, well, in the interest of time, while Andrea and Roxana and perhaps our IT support Devon can help with the translation channels, if there's anything to do, we will definitely come back to Roxana. I would now like to ask, excuse me, Kim Dewar, a parent, to share your thoughts. Some of you have children who were receiving early intervention services before telehealth services started, and I don't know if that's the case for you, Kim, but would love to hear how you're experiencing this new format and how have early intervention services worked well for you and your family, and what challenges have you and your family encountered, and how can we make the telehealth experience better for you and your family?
Thank you. Thank you for having me. I actually have chosen to report on a few surveys that Parents Helping Parents initiated, because we were hearing from a lot of families in Monroe County who were experiencing early intervention over telehealth. And we found that there was many challenges. We offered 3 different surveys over the course of time. In the summer, we offered a survey to both early intervention and preschool special ed families, and I have the results of that, where 99 families responded. Then in the fall, we decided to separate the 2 surveys for parents. Early intervention had its own survey, and preschool special ed had its own survey. So we captured their experiences in that spring and summer in the first survey, and then giving some time for early intervention telehealth services to improve, we reinstituted the survey in the fall to have a comparison between their experiences spring and summer versus the fall. We also conducted a survey towards providers across Monroe County, and that actually had 149 respondents. So 149 providers responded to our survey, and that was conducted in the fall. So, and then I could also have a teeny bit of my own personal experience, but I did want to share this rich data that we received. So in the early intervention preschool special ed combination survey that we conducted over the summer, where 99 families responded, 22.6% of those families actually opted out of telehealth for a number of different reasons. So we thought that was pretty important to share. 70.1% of the families reported that their child made less progress with telehealth services versus in-person services, or they weren't able to comment on whether they were making progress at all. And 21.2% of those families reported poor satisfaction with telehealth services. Then in the fall, we separated the 2 groups. So we just have data for the early intervention families in the fall, where 52 families responded across Monroe County. 15.7% of those families opted out of one or more telehealth services for various reasons. 29.4% of the families reported less progress being made with their child over telehealth versus in person, or that they weren't sure that they were making progress at all. And 49% of the families were in favor of returning to in person as soon as possible. The provider survey we had in the fall with 149 respondents, 89% of those providers reported families had opted out of their service. 89% of the providers reported that some of their families had opted out of telehealth services. 86.9% of the providers wanted more training in conducting telehealth services. That's where they identified that they needed help. And 43.9% of the providers reported that their kids on their caseload were making less progress with telehealth versus in-person services. So I thought that those few points were important to share. Other things that were identified were IFSP compliance was poor for a lot of the families. And for myself specifically, my daughter was actually in preschool special ed services at the time that we were receiving telehealth. And for my personal experience, it was almost impossible to comply with her IFSP just because of the number of services she had on her IFSP. So these children that have a higher level of need, it was almost physically impossible to keep up with it. I was doing more than 19 Zooms a week with her. And I actually feel like I have post-traumatic stress from the experience. I hear certain songs that were played by therapists, and I actually have a visceral reaction. It was a lot of work on my part, and I'm a stay-at-home mom who was able to dedicate my time to it. So I can't imagine other families who have had these children with a higher level of need, or other children in the home, or other children with disabilities in the home, being able to keep up with that. We also didn't hear from families that completely opted out of the service. So there's a lot of data that we weren't able to collect, because we're wondering what happened to these families that weren't able to participate for whatever reason. And there was several reasons that they weren't able to participate in telehealth. Who's tracking them? Who's following up with them? Where are we bridging that gap between opting out of telehealth and getting them into the in-person as soon as possible? So I just wanted to share that data. And just from my personal experience, I think that there is wonderful opportunities for families to use telehealth, especially in rural areas or areas that are less able to get to, like, for instance, the inner city of Rochester. But there are still tremendous access issues with equity of being able to provide Wi-Fi and devices for families. And I just feel like there is some gap in service with families who have opted out by no fault of their own. What are we doing for these families? How are we keeping them on our radar, and how are we checking in with them? Because I know a lot of families identified that they felt personally responsible to participate in the early intervention telehealth, even though it was killing them, because it felt like they were going to be penalized if they didn't participate. And others simply opted out because they simply could not do it. So there's a lot of rich discussion, but I'll let other parents speak. But I thought those data points were important to share, and I appreciate the time.
Thank you so much for both sharing the data from those surveys, as well as sharing a bit about your own experience. It's really important to hear about that. Thank you so much. All right, moving on to, so we're going to go back to Roxana and ask you to share your thoughts on how, were you receiving early intervention services before the pandemic started, and how are you experiencing this new format? How have early intervention services worked well for you and your family, and what challenges have you and your family encountered? So we'll give just a moment for interpretation. Thank you all for your patience. Okay, while we're talking about telehealth, here we are trying to figure out all of the functions of Zoom. So great. Yeah. Okay, great. Well, we'll come back to you all again. And thank you, Devon, for helping out on troubleshooting. We will come back. And so now I would like to ask Brittany, some of your children might have been receiving early intervention services before the pandemic. How has telehealth services worked well for you and your family? What are some of the challenges that you and your family have encountered? And how would you make the telehealth experience better for you and your family?
Hi, good morning, everybody. My name is Brittany Jensick. I am the president of Parents Helping Parents Coalition of Monroe County, which is an advocacy group for families with children, primarily in the 0 to 5 age group, to kind of help them navigate the world of being a parent of a child with special needs. I also am the parent of 21 children. 17 of my children still live home, and 14 of those children have special needs. So we have been involved in early intervention for the last 18 years, nonstop. It's been quite a journey. It definitely is different now than it was 18 years ago. So I do have definitely a before perspective and an after. I apologize for my cough. So, you know, I said in a, kind of a pre-teen meeting, that I want to be part of the solution, not kind of stuck in the problem. So I want to start with what I see as the advantages of telehealth for my family in particular, and then in general, what we've heard from parents in our group. It certainly is able to reach some of the far-reaching areas of our county, which are difficult to service. It's hard to find providers to go out to, some of these areas that are a far drive. We've talked about compensation for some of the providers, financial compensation for the mileage, because we really need to figure out how to provide incentive enough to service some of these more difficult to reach areas. So, kind of the equity notion that we've all talked about. I think telehealth can help that. I also know, having medically fragile children, having immune compromised children, there is an advantage to telehealth services, because whether it be due to the quarantine or due to medical situations within families, some families just are not ready to have in-person providers, and their preference is telehealth. I also know that our family has had COVID twice, and we've been quarantined more times than I can tell you because of exposure. There is certainly an advantage to telehealth during those time periods. Like Kim, I've had some negative experiences that have caused a little bit of trauma in my brain relative to telehealth. But if there's a beginning and an end for our family, it is something that we can swing and not necessarily miss all of those services if we're going to be quarantined for 2 weeks, or there's kind of a beginning and an end. And like others have said, I do think it changes the parent participation piece. Telehealth or EI as a notion is a family-based model. And I do think that many of the children in that era, 0 to 3 age group, simply cannot participate in something like that without full parent support. So it certainly brings the parent in, where I'm normally kind of in the house managing several things at once and certainly paying attention to the in-person provider. Telehealth requires pretty intensive one-to-one support. And I think the parent gains a lot from that and is able to better carry over the work that has to be done the other 23 hours a day. So I certainly see advantages. However, I also have experienced and have heard from parents in our group of the challenges. Even just on this Zoom, there certainly are technological challenges that especially early on were incredibly frustrating for people. One of the main things that we've heard, and again, that I've experienced, is that it is very, very difficult to do telehealth when you have other children around, and specifically other children with disabilities. It really requires, again, which is an advantage, but it requires pretty intensive one-to-one parent support. And, most moms I know, myself included, are used to multitasking and doing 73 things at once. It's really, really difficult to provide the degree of support that's needed for the one-to-one telehealth when there are other children, and again, other children with disabilities that are in the background. Engagement was wonderful for some of my children. It was terrible for others. Some children are just not meant to, be engaged via screen. Early intervention is supposed to be provided in the natural environment, and my children are not screen users. So it was, while they were certainly in their home, it was not necessarily a natural environment for them to be learning. It was a very different method of learning for them. Obviously, everybody's talked about it. Access is a challenge. People don't have internet, people don't have devices. And then, during the pandemic, it was working parents. I mean, parents, and to this point, even if this pandemic becomes an endemic, there are people who are never going to go back to work. Many are unemployed, but they are also working from home, which makes it really difficult, because you can do some working from home when your work doesn't involve Zooms or background noise or any of that, and still kind of had kids present. You really can't work and be the one-to-one support for teletherapy that these children need. Personally, I had a lot of difficulty with access because, and I know this is personal to me, but it is exemplary of access issues that exist. I had 17 kids home doing either homeschool or early intervention services. So not only did I have to have 17 devices, but I had to have the internet to be able to support that, which I didn't. So, my county never offered to pay for commercial internet service, which I had to upgrade to in order to support all of the devices and all of the users that were Zooming at the same time. At one point in the pandemic, I had over 170 Zooms a week that I was accountable for my children between school age and therapeutic services, which, you physically, even if I could provide one-to-one support, we were quarantined so much, I couldn't even have people in the house to help me. It was me and 170 Zooms and 17 children. And I also have children with hearing loss and vision loss, which makes it made Zooming a nightmare. I had my children who have hearing loss use interpreters at school. Again, I know it's a technological issue, but it was very difficult to figure out the Zooming, the interpreter. The kids are trying to figure out what they're looking at. Do we use one device with two screens? Do we use two devices? That was very difficult. I had a kiddo with vision loss who glued all of the pieces to a puzzle he was working on for visual spatial perception to the computer monitor. It was so challenging with the vision and hearing loss that was just an added layer of difficulty, not just specific to our family, but for our family. I said early on, I want to be part of the solution, not the problem. I do think telehealth is here to stay, and I don't think it's a bad thing that it's here to stay. I'm hoping it always continues to be an option, and that it continues to kind of bridge some of the gaps between initiating service and possibly in person, or be an option for people with the immune compromised or the medical issues or the quarantine or the far reaching. I hope it continues to be an option, but I don't necessarily think it's a great go-to. As others have mentioned, I think training has to be a part of this. I had some therapists who really were pretty great at it right out of the starting blocks. I had some that, like myself, are technologically challenged, and it just was so unnatural that it was awkward. I mean, it was not a typical learning environment. It certainly was not a natural setting. It was really difficult to keep the kids engaged. I really, really, really think we need to do some pretty intensive training. I also think if early intervention is a family-based model, and I get some brush from this with providers because I know that it's supposed to be one-on-one, but I think it should be a family's option, whether or not the therapy involves some of the other children in the house. I think, and then certainly the provider would have to agree too, but I think you would get a lot more, I think you would get benefits for the whole family. I think you would get more engagement. I think you would have more parents that would be able to swing it if the other children were allowed to participate. And I know that adds a whole nother layer of complexity for these providers who I sympathize with. But again, given it's a family-based model, and given one of the major challenges we were hearing and I was experiencing was that there are other children in the home, I think we need to figure out how to include how do we include the batch? I mean, how do we make this work for everybody involved? And then obviously access and equity. I mean, we need to figure out how to make internet devices, make this all available to whoever it needs to be available to. I don't know if it's CARES Act funding. I don't know if it's, governmental funding, but it is absolutely not okay that people do not have the access that they need to these services. If one of the advantages we're saying to telehealth is that we're able to provide it to people in far-reaching areas or, inner city that generally we've struggled to get some providers in, whatever, we need to figure out how to get them devices. We can't say it's a positive, but then not support the access to it. So I think it's a great option. I think it can be really, really improved upon. And I think that there are some major challenges.
Thank you so much, Brittany, for sharing your insights and your experiences. Really appreciate that. Okay, and now back to our final parent, Roxana, and we do not have the interpretation channel going, so we were all going to hear Roxana in Spanish, and then we'll hear Andrea in English. Thank you so much, Roxana, for your patience, and thank you, Andrea, for helping make this happen, and thank you, Devon, for doing our tech side of this. Good morning, and thank you so much for joining us, Roxana. Some of you might have children who were receiving early intervention services before telehealth started. How has this experience with this new format been for you and your family? How have early intervention services worked well for you, and how have they been a challenge?
Ok, entonces la pregunta, Roxana, vamos a intentar responderla, es ¿cómo ha sido su experiencia con el servicio virtual de terapias de intervención temprana, que le decimos nosotros telehealth? O ¿cómo ha sido su experiencia? ¿Cuál ha sido? Queremos saber las dificultades y los beneficios que usted ha encontrado en esta experiencia.
Las dificultades fueron porque eran virtuales. Y sentía que era un poco difícil porque no me iban a ver en persona la niña. No era lo mismo estarla viendo en persona que así por cámara. Porque tenía yo que hacer la terapia que ellos me estaban diciendo, de darle vuelta a la niña, de pararla, de levantarla. Y ellos solo me lo hacían. Pero a la vez también agradecida porque me ayudaron mucho. Estaban al pendiente a diario diciéndome cómo hacerle para que la niña reaccionara al problema que se le estaba viendo.
Ok, voy a traducir ahora. So Roxana was actually very grateful of the service in general. She started talking to us about the difficulties. So the difficulties that she found, it's in a virtual setting, is the fact that she felt or she perceived that she had to be trained to perform the tasks with the child, with her daughter, right? What she also mentioned is that the difficulties that she was expecting to have it in person, but because she had to do it virtually, she felt that she was trained to perform the activities with the child at home. Entonces, si nos podría por favor contar, Roxana, acerca de los beneficios que usted tuvo acerca de esta experiencia, tal vez no solamente del servicio, pero los resultados que ha visto en su niña.
Perfecto, porque cuando yo no sabía de lo de la niña, que traía ella una dificultad, y ellos empezaron a hablarme y a decirme cómo le tenía que hacer para la niña. Yo empezaba a hacerle las terapias en la casa, ellos me hablaban en la tarde si se las hacía y que cómo reaccionaba ella. Y fue para mí maravilloso porque cuando ellos me hicieron 5 terapias por teléfono, y ya a las 5 ya estaba, habían 3, un doctor especialista, y hasta celebraban porque la niña ella solita reaccionó a levantar su cabecita porque su cuellito no se le notaba, y celebraban el doctor y todos que estaban con él, que la niña estaba reaccionando a las terapias que ellos virtualmente le estaban dando y yo se las estaba haciendo.
Es la terapia para su niña para Sigma era de motricidad.
Sí.
Ok, voy a traducir ahora, ok?
Okay.
So on the flip side, everyone, she's just sharing right now on the good things about this experience. She started saying perfect. She says that she felt wonderful about the team that worked with her. Her therapist was really patient in training her, in educating her on the challenges that they were facing, right? In terms of the specific concerns that this child has, where in regards to gross motor. So she immediately, not immediately, but very soon after she specifically mentioned 5 therapies, she saw changes, positive changes in her growth development. She was lifting her head, something that the baby wasn't able to do at the beginning of the therapy or before starting of therapy and just shortly after evaluation. So she saw those changes in the baby, and she also felt that she was very tended to. The professionals call her all the time, follow up with her all the time. So in that end, I guess she really felt, what she was telling me is that she felt seen, she felt heard. Yeah, she really felt that she and her child were cared for. Not sure, Laura, if you want to continue with the next question, or you have any other questions about this part?
Is there, yes, thank you so much, Roxana. Is there anything that you feel would make the telehealth experience better for you and your child?
Hay una pregunta, Roxana, acerca de en qué usted opina que se puede mejorar el servicio virtual de consultas y terapias.
Para mí sería como usar como más personal para que ayudarle más a las personas, porque por ejemplo nosotros que somos hispanos, muchas veces no tenemos la experiencia porque en nuestros países no nos ayudan como nos ayudan acá. Y para nosotros es una experiencia bonita que estén atentos ayudándolos, pero muchas veces no hay el suficiente personal para ayudar a las personas que ahorita pues somos muchos hispanos en el país. Eso sería, pero lo de la atención está perfecto. Bonito como le ayudan a uno. A pesar que uno no es de este país, pero lo toman en especial a los niños.
So for that, she had to say that she will suggest to have more people in staff, especially Spanish speakers. She felt actually very, again, grateful about the service, about the option. This is something that as a Spanish speaker and somebody who comes from a different country as an immigrant, you don't see this type of services where she comes from. So she was very grateful that this is an option for parents of children with special needs, and you know that she lives in an area where she can access this type of services. But she still feels that it is very important to keep this in mind, and especially because I smiled while she was answering this question, because she did mention that there's a lot of us now. So so and it's true. So you know, what she was, just to finish up with her thought, just have more people in staff to provide the service and to sorry, let me just clarify something from her, okay? Roxana, cuando usted dice que preferiría que tengan más personas trabajando en este servicio, ¿a qué específicamente se refiere? ¿Usted se refiere al idioma o en consulta virtual?
En las dos cosas, idioma y consulta virtual, porque también eso era un poco difícil para nosotros, porque muchas veces nos hablaban siempre solo que hablaban en inglés, y yo y mi esposo pues no hablamos en inglés, apenas tenemos 3 años de este país. Entonces, también para ellos era un poco difícil, porque sí se ve la ayuda, pero también se ve que se les hace difícil hablando el español.
Okay. Okay. I asked her to clarify why she feels that there needs to be more people providing the service. And she just clarified, and I asked her if it was because of language or because of actual assistance needed. And she said both. She thought that for the language part, obviously it's key. They are immigrants and they have been in this country for a few years and they're still trying to be fluent in English. But certainly having someone in your own language that can provide training, guidance, therapies, evaluation, it will be very helpful, especially to understand something so new that is not spoken of where she particularly comes from. Lara, would you want to go to the next question or any questions about this from the audience? I'm not sure.
Thank you so much. Excuse me. Thank you so much, Roxana, for sharing this. It's very important to hear your accounts and your experiences.
Gracias, Roxana, por compartir con nosotros su experiencia.
Okay.
And thank you for your patience as we figure out Zoom. Okay. Wonderful. Thank you so much for providing support there, Andrea. Thank you, Roxana. And so now in the interest of time, we are going to skip our breakout group discussion and go into our second panel of folks. So this will be more of a policy-oriented discussion. We have Jacqueline Shannon, who is the Associate Professor of Early Childhood Special Education, Early Intervention, and Chairperson of the Early Childhood Art Education Department at Brooklyn College. I hope I got all of that right. She is also a former chair of the New York City Local Early Intervention Coordinating Council from 2017 to 2020. We also have Morgan Finkel, who is an assistant professor of pediatrics at Columbia University Irving Medical Center. We also have Linda Beers, the Essex County Public Health Director, chair of the Child and Maternal Health Committee of New York State Association of County Health Officials. And we have Betty Baez-Mello, the Early Childhood Education Project Director at Advocates for Children of New York, and a member of the Raising New York Steering Committee and Coalition. Thank you all so much for joining us. Just going to hop right into our next set of questions. And I will first ask Jacqueline, can you discuss any research in this area of child development and learning by telehealth? Do you have an opinion on the model, including the benefits and challenges of working with infants and toddlers through telehealth?
Great, thank you for inviting me, and it was really powerful hearing the voices of parents and providers during this time, and very valuable for me to hear. And also much of your recommendations and your suggestions and the barriers actually align with much of what I was learning about and reading about in early intervention that has been using telehealth. Several states have been using teletherapy for several years now and have done some research on it. Much of that has been really targeted to communities and more rural areas where there are a lack of early interventionists or children with specific disabilities like children who are blind or deaf, where there's even fewer interventionists who have that special skill set. And a lot of the findings were that it was beneficial. So children who, in the end, there was some research where they were doing control and not and having, and they were identifying that parents who had telehealth, those children had good outcomes and the parents were more involved. But what was critical was this idea of what's right, early intervention is family focus, which many of you brought up, and right, coaching parents in this process and thinking about families first, which Brittany, I mean, right, like just sort of having an agenda as an early interventionist going into the home, whether it's in person or telehealth, and sort of, right, not being aware and mindful of what's going on in the context of the family in the end is a disservice. And some of the research was showing that as well, that those providers who were going in sort of with this more direct approach were finding less benefits to using telehealth, whereas those who came from a family-focused idea in training and were well prepared were more effective at outcomes. Some of the benefits in terms of allowing more flexibility was that you know, the providers could observe families during feeding time, during sort of more, as Roxanne had brought up, being able to see a family after work, right, when they were feeding, and sort of when finding out from the family when did they want to have you come, rather than sort of right coming at a time that worked best for us. Being able to take video of the child's routine and sort of share that. So really being comfortable using the video as a way to share what the parent was observing, or you know, showed something that they were struggling with, and then they could video that and then share that with the provider, who then can see that and then give feedback and support. So it also allowed times for saving on travel. So providers could see more families in the end as well. Let's see, cost effective. They were able to work outside the home. People were more available then to even work on the weekends when more families were available. And also, as Brittany had pointed out, why not have the children? So you've got families, right? It's family centered. So there was that ability to include siblings in the process, right? Because right, 24 hours a day, everyone is together, and why not give them the strategies and ways to best support their siblings as well. So it's not just, again, this provider directed or parent directed service, but really how do we best build on the strengths of families and where are their needs. And what some of the things that we're trying to do. So there were benefits done properly, benefits for children. Children were improving in their language and their social communication. Parents were satisfied. More parents were more engaged. That increased their confidence and their skills in supporting their children. Some of the barriers, as you brought up too, the additional barriers, the technology. If we're going to have telehealth as an option, then we really need to make sure that everyone has access. And again, unfortunately, it's those communities that especially are already lacking the resources to have early interventions come. Those are the ones who are needing, who do have bad Wi-Fi, and we really need to put the money towards making that happen, so that anyone who wants that as an option should be able to have that and have a quality interaction with a therapist through the Zoom if they want to have that, and not feel like they can't have that as a choice because they have bad Wi-Fi. Back to that equity issue. And one of the things we're really pushing for too is like childcare, right? There's now also a childcare crisis. And so how do we also build up the communities within these areas? And we have providers who come from those communities who are early child care providers. And many of those children maybe need EI services, and having our child care providers trained in early intervention, right, become special educators so that they then can integrate and support families and children with early intervention as well. So we're trying to really push for, and we have an advanced certificate in early intervention and parenting at Brooklyn. So really trying to get pre-service, so get people out there right away before they become providers, on learning how to engage, getting them passionate about wanting to support families and really thinking about family-centered work and coaching and building on family strengths rather than more of a direct provider way of being and thinking. And bringing in the diverse language learners in Brooklyn and CUNY. So the New York City's Department of Health, they have partnered with several CUNY schools. So we have the speech and language department, our early intervention, early childhood special ed program. We have Queens College, we have SUNY Downstate OT, and we have Lehman's speech program. So we're all pushing to get educators, speech and language pathologists, really much more mindful, be aware of early intervention, and get them passionate about wanting to really be in the field, to learn about infant development, to learn about families, family-centered work, reflective work, and be committed to really working and growing and building on family strengths and being a thought partner with families. And teletherapy, that's something now too in our own courses we're trying to bring in, and having our students experience how to use teletherapy as an additional tool, right? Because it's not going to go away. And I think there are many benefits to it, as many of you had shared, as long as it's done in the right way, essentially. Right, so those are some thoughts that come to mind. So,
thank you so much. Wonderful. Yes, that's really helpful to hear, especially from the academia and sort of student education side of it. Thank you. All right, next we have Morgan Finkel. And Morgan, as a pediatrician, can you discuss any experiences that you've had with the telehealth model for early intervention? What are some of the benefits and challenges you've seen to having services delivered via telehealth for young children with developmental delays and disabilities?
Sure. So thank you for having me. And it was really fascinating to hear from the providers, parents, because as a pediatrician who, so I primarily work at a clinic based in Washington Heights, so serving primarily an underserved population of families with low socioeconomic status, majority first generation immigrant families. So I see their struggles, and they tell me about issues with early intervention, but I am sort of a step farther away, obviously, from the system from everyone. So it was really fascinating to hear from everyone who's directly involved. I think from listening to the conversation, there's a lot of parallels between just the medical field in general and how we're dealing with using digital video interventions and early intervention. I mean, during the pandemic, we were also forced for a lot of our visits to go to video visits, and we are still constantly doing these, constantly changing and trying to understand like what's appropriate for in-person and what's appropriate for video telehealth visits. So I think the important part is really to know that there's a lot of work that needs to be done on research in terms of what is best for one versus the other, and recognizing that maybe something that we were doing on video during the height of the pandemic, when we were sort of just doing what we had to do, is not going to be appropriate as we sort of move further on down the line. I can tell you just from interacting with my patients, that's similar to, interesting to hear about the parental survey about the people who have dropped off, that I think my biggest concern during the past year has really just been the lack of engagement during the pandemic. A lot of families were just getting services and just completely fell off for sort of unknown reasons, maybe the same reasons why they weren't even coming to their pediatrician to begin with. So we weren't really necessarily even able to know that they fell off. And I think I have heard from a lot of my patients that when EI teleservices came up, that they sort of were just completely closed off to the idea, and they couldn't even imagine being on a video visit with their child, especially kids who had high needs like autism, where they were difficult to engage in person, and they sort of just shut down to the idea of EI via video, and sort of just said, no, we're not doing that. We're just gonna wait, or we're gonna completely say no. I think that I completely understand where they're coming from. Treating a lot of patients who have significant delays, especially with the patient population I deal with where parents are often working or in a home that doesn't have great connection via internet. And I could attest to the fact when I'm trying to do video visits with a lot of my patients that it's not just an issue in distant areas of New York, it's an issue even within New York City for a lot of our patients, or especially parents who are living in housing areas where they have, so a lot of my patients live in like a one room, are renting one room with multiple family members. It's really difficult to engage a child in an environment, not one-on-one on video when there's a lot of things going on. And I think it was great to hear from the parents when there's a lot of kids around. It's really just kind of impossible to expect parents who have a lot of stuff going on to be able to be fully engaged on video for a long period of time. So I think, unfortunately, I ended up hearing a lot of the stories about bad experiences. I'm sure there are stories of good experiences, but a lot of my patients ended up coming to me and saying either I tried video, it wasn't working, or I just wasn't open to it at all. And then for the sake of time, I know we only have a few minutes more. I just want to say that I am very concerned about disparities and the potential for worsening of disparities if we sort of decide that we're going to use telehealth to reach the populations that are harder to reach, and then don't sort of give them the option for having in-person. I know the Citizens Committee for Children report focusing on New York City has really shown these massive disparities in access to early intervention. And I think that there's a lot of potential for bridging with telehealth. I know a lot of people talked about how it was great getting people services earlier and that it can be helpful. But if it's not shown to be actually equivalent and is not really the same as having in-person early intervention, I do worry about the potential of people saying, oh, well, we're able to get them on telehealth and then sort of never really giving them that option of having in-person, and the potential for worsening disparities. So I think making sure that we're focusing on option and choice for all families, no matter where they live, and making sure that we're not worsening these disparities by trying to offer services that might not be equivalent. So that's my main concern for my patients.
Thank you so much, Morgan. Appreciate that. And yes, as we're running out of time, for those of you who are able to stay a little bit past 11:30, that would be great. You'll want to keep hearing all of our amazing panelists in our discussions. And just going to also say, please feel free to share any comments or responses or thoughts in the chat, since we don't have really much time for breakout discussions. All right, and now we are going on to our next panelist, Linda Beers. As the state looks to continue using telehealth as one way of delivering early intervention services, even after the pandemic, what does the state need to keep in mind to ensure equitable access to early intervention services for all?
Well, I will start by saying thank you. It was great listening to all of you as the EIO of a county. And I think maybe I need to just go back to a little behind the scenes. Every county has an EIO, that's me. I'm an early intervention official. And we are challenged and tasked with following through on early intervention. So several of you mentioned the thought that what happened with parents that dropped off or opted out. Just because they opted out of services doesn't mean they lost their service coordination. So every early intervention parent is assigned a service coordinator, and we track those people regardless of whether you have gotten services or you're opting out. We will circle back with you and ask, especially during this COVID time. I think it's really interesting because prior to the pandemic, there was a huge push by many providers and by county officials to get the state to allow us to do telehealth. I don't know if anybody remembers that. It feels like 100 years ago, but it was a fight, right? We're going to research it. We're going to look at it. We're not sure. People pointed out to all of these other states that did it, because even prior to COVID, people realized there might be value in doing telehealth. So I think if I learned anything from COVID, it's that the story's not written. Right? Every day with all new technologies, the story's still being written on early intervention. I think it's more important and really imperative that we build relationships, as somebody mentioned so clearly, but build resiliency in our parents, that when something happens, and all of us as providers, I as a provider as well, that you have to switch gears. I think telehealth was one of those amazing things that came to the rescue, right? So the option early on was no service, none. or telehealth, to be clear, because nobody was allowed to go into homes in the early onset of COVID. We are in Essex County, my county, I'm real rural. So just to give you an idea, second largest county in that state, we have 5 stoplights in our entire county, and it's 89 miles across our county. We have an average of 21 people per square mile. So telehealth offered a provider an opportunity to see so many more children in a day, because most of our time is spent driving back and forth. So everybody has their unique challenges, and winter services are, canceled because of inclement weather. So the question posed, was, what does the state need to do? I think the state, and I think I've heard really loud and clear, and I certainly will advocate that this is one of many approaches. I think that, like all things, especially in special ed, that or instruction, that it's got to be centered on the person and the individual, what works best for them. I've heard loud and clear, some people like it and some people don't. And I think that has to be at the forefront, what works for the family, and it should be their choice, no one else's, how they get their services delivered. This is, family-centered model. That means the family should choose. And I do like the idea. I really, really did like the idea. It does take us time to always get somebody onto services. And it really never dawned on me that they could have services started right away. What if you just had a provider that started everybody while everybody else was waiting, right? And what a great concept that is, because there is a delay in that. So I think there's lots of things to be taken away from them, but probably more, and learned more in COVID, is that layered mitigation has been the best process, that not one size fits all, that multiple types of services stacked upon one another, allowing for choice and I can't think of it today. Intertwining of these would be the best way to move. So, for example, what if you start with telehealth, go in person, and maybe you have some hybrid model? That's what's really happening across the state. I have kiddos that will probably never, as somebody pointed out, ever go back to in-person work. I mean, their companies are absolutely ditched that model, and they are saying, okay, here's your office space, which is your home. So I think you have to be lifelong learners. You have to be ready and willing to change. And again, I really believe it's family-centered, and that as the state looks at these models, we need to really look at payer sources. And so I would be remiss if I must talk about covered lives and tell you how imperative it is. It really is. We need the third-party billing insurance to pick up. They have been remiss in paying for this, although they were ordered to by the state. Medicaid pays for 70%, and they're at best at 16%. So we really can do better with that. I believe if those third-party insurers paid, that there'd be more money for services provided to providers, and there'd be more ability to do, as somebody else pointed out, well, if I'm taking services in my home, there's clearly cost savings there, And why shouldn't they be passed on to maybe computer apparatuses and things? So in our county, we were mailing out packets to help for telehealth. So our PTs got together, and we mailed out every month. We've mailed out a package of jump ropes and yo-yos and whatever else worked. And those therapists used those things. We didn't expect them back. We got a little tiny grant to do it. And so people were saying, you had to use what was there. So we were trying to be as creative as possible. Because of that creativity, that model will last for many in Essex County. But I will tell you, I loved the data, and thank you for that. I would say we had more opt-out than 22% here in Essex County. It was really challenging. I also would say about equity, if you layered a map, which we've done many times, about where broadband access is and where low-income families lay, that map will be covered repeatedly, where there is no services in a map laid over in zip code where income is. So there's a lot of disparities just based on access to internet. So lots of things need to be done. We do have, somebody mentioned CARES Act money. I would like to see, and certainly advocating in my own county, that some of that money really be looked at broadband services. It is imperative for the growth of any community, that community and all the people have access to internet, so the kids can thrive I also work with school age children, and we have closed and gone remote repeatedly. Kids in quarantine so appreciate that. I cannot tell you how many orders of quarantine I write a day, and isolation. And I so appreciate that I had children and parents. You could go to any school here on a weeknight and find cars all in the parking lot. Those were parents sitting with their kids downloading their homework so they could do their schoolwork because they had no internet and the school had gone remote. So lots more to be learned, lots more to be challenged about this. But again, I guess the big takeaways is it's one of many tools. I think it does have value. I think more than anything, I think I've learned is from all of you even today, lots more needs to be taught about this. There's people, I believe that you can learn anything. And I don't believe that it's supposed to be intuitive. As we all had struggled even to get on here, I had providers that did so much work at presentation, did a great job at telehealth, but they couldn't manipulate an Android versus an Apple and that's not helpful to a parent. If you've already put a parent in a frustrating situation, they're twice as frustrated when they can't make the technology work. And if our answer is we're no good at it either, we should be not given that answer, right? If we're presenting it, we better be experts in it. I've never walked into a classroom and said, I don't know how to use the Blackboard, or I don't know how to use the services I'm, doing. So I think, it's a big learning curve. I will say we advanced telehealth 10 years, if not more. It's a billable, it's out there. The platforms have done amazing jobs. Even this one, Zoom, 1,000,000 times better than when we started, right? And I believe that a platform could be built for early intervention. Imagine where you could tap in and parents would have resources and whatnot. I think all of those things stand to have money invested in them and more to come. So thanks for having me here today. I'm trying to keep you back on track.
Thank you so much, Linda. Thanks for adding that very unique perspective to this work that is important to keep in mind. Absolutely. All right. Yes, so it's 11:33. Thanks for those who have hung in there with us. Our final panelist, Betty Baez-Malo, has graciously offered to hold off on her discussion, and we'll share that in the follow-up email that we'll all be sending out. So we don't have really any time left, but I want to thank you all so much for joining us today. And thank you especially to all of our panelists for sharing all of your time and your expertise and your knowledge. It was incredibly meaningful to have such a diverse array of knowledge and experiences represented in this discussion. And this is really one of what we hope will be continued efforts as we're all working so hard to support families across the state and work towards equity for everyone. We hope this has been an opportunity for all of you to learn more about the discussion, amplify the importance of equitable, timely, high quality early intervention services for all infants and toddlers. And as a follow-up to this, please keep an eye out in your inbox, probably tomorrow, for a follow-up email that will include some of a recap of the issues and themes that have been discussed today, as well as information on advocacy efforts, information on the Covered Lives Assessment Bill that Linda mentioned, and other efforts that you all might not know about are welcome to join, and some examples of best practices across the country to help inform your advocacy efforts and really keep moving all of this work forward as we continue to learn what works best, learn how to support everyone, and to adjust to the situation at hand. Thank you all again so much, and I hope you all have a great rest of your day. Thank you, everyone.
Thank you.
Thank you so much.